Well, it's day 2 of labor action by a major public sector union in New Brunswick. Some medical services have been cancelled as a result, and thousands have joined the strike. Now, the Premier says he isn't ruling out using the Emergency Measures Act to force them back to work. Mrinali Anchan reports.
Healthcare workers and support staff are among the thousands of CUPE members who took to the picket lines in New Brunswick today. Some are considered essential workers, but many are not. Workers rallied outside the Fredericton Inn this morning, including the president of the local, which represents support service workers, including medical lab assistants. She understands service disruptions are difficult, but hopes the strike will help highlight the need for a full overhaul of the province's medical system.
If you have a loved one that's in the hospital and they're not bathed every day or they're not bathed on a regular basis, that affects the public as well. We never like to see any kind of cuts to services, of course, but that is the nature of the beast. That's where we sit today.
Several COVID vaccination clinics and assessment centres are closed as a result of the job action, and according to the province, laundry services in some hospitals and nursing homes are also being affected. Premier Blaine Higgs held a news conference Saturday afternoon to address the situation.
Well, I think as I mentioned about screening, so certainly in some hospitals, there's the screeners would have been taken off duty, and those are people that are just checking at the door. There's also vaccination clinics that we're on. We are directing people now to the pharmacies and managing that.
Now, the Premier has said he is considering using the Emergency Measures Act to mandate healthcare workers back to the job, but that he does want to take a day to assess the situation before taking that route. The province and the union are at odds over issues like wages. Mrinali Anchan, CBC News, Fredericton.